What's up, everybody? Welcome back to my channel, Morgan Allena True Crime and Mystery. And guys, Gypsy Rose Blanchard did something that I never thought I would see her do. Well, I guess I technically still didn't, but she actually started to come clean about the fact that she has a microdeletion chromosome disorder. That a lot of people have been trying to get this information out, saying that she actually had quite a few different health issues when she was a child, and every single procedure that she actually had, not made up, she needed those procedures and they weren't done for no reason at all. But as I watched through Gypsy Rose Blanchard's 2-part video on TikTok, she absolutely continued to lie. And that's what makes Gypsy such an amazing liar, is that she's coming forward with information voluntarily and acting like she just wants to be transparent and wants to be honest, while in the same sentence she's lying to your face, but you don't pick it up, because why would she just come out and say all this information and then lie about it still? These little lies that contain little parts of truth are some of the greatest lies that she's told, and that is why they are so incredibly effective on the public. I personally felt like somebody was making Gypsy make these videos, or she felt somehow pushed into making them, probably because there's multiple content creators that are calling her out on this information, and she wants to get ahead of it before it gets too far into the mainstream media. As we all know, Gypsy has for almost ever since this information came out that she had a microdeletion, she's either A, denied it, or B, just said she had it but was completely unaffected by it whatsoever. Clearly that's not the case, and then she even says that in this video, or these 2-part videos that she posted on TikTok, and she says how she was affected, but of course she actually minimizes the effects that she suffers from and twisted to make it look like her mom for sure definitely had Munchausen by proxy, and used this diagnosis as a blueprint for her scams and the abuse that Gypsy claims she suffered. So if you don't have a TikTok, don't worry, I'm going to sit through both of these videos with you, and I'm going to point out every single lie that Gypsy told during these videos and prove to you with the medical records why they're lies, and just show you what the truth actually is. Gypsy said that herself, what makes an effective liar is to have a little bit of the truth in there to make it more believable, and that is these videos are just perfect examples, coming forward and making the public feel like Gypsy's being vulnerable and opening herself up to criticism by being honest about these actual conditions that she has and the abuse that her mother put her through. She has managed to get more people on her side than I've seen in such a long time. Gypsy has been going off in the comments on TikTok. If you don't have TikTok, I'm going to show you everything that you need to see from what Gypsy has been doing on the TikTok app these last few days, and it is just unreal. From talking about Nicholas Godejohn in a horrible way, to lying about her chromosome deletion and the abuse that she suffered by her mother, Claudine Blanchard. It's too much. But before we get into that, make sure you hit the like button and subscribe if you are not already. And I want to say thank you for the super thanks from PeaceinChristAlonePowell. Thank you again for the super thanks. I really appreciate that and everything that you've done. It means everything. But let's get into Gypsy Rose Blanchard's lies and expose it for what it really is. It's obviously no coincidence that Gypsy manages to go be more active on social media every single time her season starts to come out. She's trying to generate drama amongst the content creators to make them talk about her. But of course, she doesn't really like it when they start spreading truth and proving her as a liar with her own words, which is pretty much why that needs to be the focus, not making fun of her looks, not bullying her, because that makes her look like a victim. I really wish people wouldn't do that, honestly. I get there are some that just do it for like comedy or whatever, but like the ones that want to expose Gypsy for who she really is, I feel like they should tread carefully on the whole bullying thing, because it's not an effective move in my opinion. But if you come to people with facts and evidence and proof that Gypsy herself has said or done, That's hard to argue. And that's what I like to do. So let's go through that. I'm going to play the video. There's part 1 and part 2, and I'm going to break them down for you as we watch.
Know that I have a rare genetic condition called microdeletion 1q21.1. What exactly is that? Okay, let's dive into that. So a microdeletion is when a small portion of a chromosome is affected, and in my case, it's region 1q21.1.
I feel like Gypsy starts this video out almost like she's about to literally burst into tears. This seems incredibly painful for her to actually have to admit that she does in fact have a rare genetic disorder. Because, for one, it explains every single operation and procedure or doctor visit that Gypsy has ever had, literally ever. But Gypsy, of course, leaves out incredibly important information and key context from her life story that completely erases the narrative that she's trying to paint of her mother being medically abusive to her as a child.
So a microdeletion is when a small portion of a chromosome is affected, and in my case, it's region 1q21.1. I was first tested for this condition back in 2012, and then again late last year just to confirm that the first results were correct. So think of it as this.
Even something as simple as the year. She has access to her medical records. I don't know why she acts like she doesn't have access to them and lies about the simplest things. She went in 2011. Why lie about something so small? I don't really get it. But she lied about that. 2011 was when she was diagnosed. At that point in time, she had not been going to the doctor regularly whatsoever. She was going through year-long periods of totally not going to the doctor, not going for checkups, not going for anything whatsoever, except probably to like the emergency room to clean her feeding tube. But other than that, she was not seeing specialists. She was not getting operations. She was honestly not seeing them at all, and it's noted in the medical records.
So think of it as a sliding scale. It affects the area between 145.4 and 147.8. So where do I fall on that? Well, I don't fall exactly on that number, and I'll explain. So my results are just a smidge different than the standard scale that we learn about. So I am affected through 145.927 through 147.828. So what does that mean? Okay, next slide. So again, thinking about it as a sliding scale. This is where microdeletion 1q21.1 begins, and this is where it ends. And this is my results. I'm slightly off of the standard here and here. So that small difference makes a big, big difference in my health, my physical appearance, and other health concerns.
I feel like the way that she's describing this is a little bit misleading, because if you guys remember what a chromosome looks like, I don't know if you guys remember studying this in like 8th grade, they're like the little X's that are through your DNA. Right? So she's gonna put out a little diagram or whatever to kind of show that she's not affected on the whole gene, but it's not necessarily true. So like the X, the arms, that's where she's affected on the long arm of the X, because they're like at, sorry, I'm doing all these things with my hands, but the way that they look, there's one that goes up a little bit further, and she's affected on this long arm of the chromosome.
Microdeletion 1q21.1 puts those affected at a greater risk of developing autism. In addition to being at a greater risk for developing autism, these other health concerns may be correlated with this condition, such as seizures, muscular dystrophy, and mild mental delays. Another characteristic of this condition is having mild dysmorphic facial features. So going back to my memoir, I talk about how I believe that my mother was using this condition as a blueprint for some of the health concerns she claimed I had. So now knowing what we know about microdeletion 1q21.1, let's try to narrow down what I did have wrong with me versus what I didn't have wrong with me, and what is malpractice and what was actually necessary.
So Gypsy is using these things like small, this small sliding scale, this small area. She actually had a microarray which said she has a 2.74 mega base interstitial deletion of chromosome 1q21.1, meaning a large chunk of the base of the chromosome is deleted, hence why it's called a microdeletion. And obviously the chromosomes are very small, but that small deletion, that means she doesn't have it, can affect a lot of things. The region that she is missing the chromosome from contains more than 20 annotated gene transcripts and has previously been reported in association with neurodevelopmental disorder and highly variable phenotypes ranging from asymptomatic to severe developmental delay and multiple congenital anomalies. The mother was tested and was found not to carry the deletion. The father cannot be reached. This is from her medical records from what's his name again? J.B. Le Pichon, the French doctor who is a neurologist who did the genetic testing on Gypsy Rose in Children's Mercy Hospital in Kansas City. As you can see here in the document that I'm attaching to this, it is a letter that is written to Gypsy's primary care doctor, Dr. Steele, by J.B. Le Pichon. He is writing to Dr. Steele saying what he discovered in Gypsy at the neurology clinic. He saw her in the clinic last December in 2011. She was accompanied by her mother. As you know, Gypsy is an almost 18-year-old young lady with a complicated past medical history, including a previous diagnosis of a muscular dystrophy. Again, a muscular dystrophy. It's not saying exactly muscular dystrophy, but that A means it is some type of muscular dystrophy, which muscular dystrophy is a weakening and a breaking down of the muscles and their fibers. It is a group of genetic diseases that can cause progressive muscle weakness and degeneration, leading to a loss of mobility and potentially affecting other organs. So while there can be, people typically will just view muscular dystrophy as just one disease in itself, it can come from a different variety of groups of illnesses or disorders, and not just be one symptom of the disorder that it may come from, including abnormal gene mutations. And I want to remind you that once again, this microdeletion was not discovered until the year 2008. So as Gypsy claims throughout this video that her mother used this microdeletion as a sort of blueprint for the abuse and the medical manipulation that she put on the doctors, that's literally not possible. I made a video about this a few weeks ago about that's just statistically impossible that Dee Dee would somehow manage to pick and choose and grab all of these random disorders that Gypsy didn't have, and then they actually add up to be a perfect recipe for an unknown chromosome deletion. Not possible. Literally, there's no way that could happen whatsoever. She just randomly closed her eyes, picked 5 illnesses out of a book, and then created a new disease. No, that's not possible. Gypsy had these issues, and it's very well documented throughout her medical records, and that is why she will never ever find an attorney to represent her for medical malpractice. Ever. But of course, she doesn't want you to know that the disease wasn't discovered until 2008. And Gypsy was diagnosed in 2011, 2012, right? That would ruin the narrative. So all this little bits of truth hides the lies much, much better than if she was just coming out and saying, I'm totally unscathed, which we can obviously all tell Gypsy has some issues, right? We can tell it's not a dig at her, it's not anything. But she has continued to maintain this idea that she has completely no symptoms. She is 100% unaffected by this microdeletion, and that's just simply not the case. So I feel like she's being forced at this point to address what people are saying because it is actually true, and they are all aware that it's true. They don't want this getting out because that would prove Gypsy to be a liar, which she is. So she's going to tell you some information and then casually leave out key context and key facts, which is still lying. But it sounds a little bit better and it makes it more believable because she's coming to you as being vulnerable and open and honest.
The condition microcephaly is closely correlated with this condition. Microcephaly is something I actually do have. My head is smaller than the average. Muscular dystrophy is also something very common with this genetic condition. However, muscular dystrophy does not get better with time, it gets worse, as you can read. All forms of muscular dystrophy grow worse over time, and muscles progressively degenerate and weaken. So therefore, there's no possibility that I had muscular dystrophy when I was undergoing all of these surgeries. I have a scar on my right thigh from being tested for muscular dystrophy, and it came back negative. So again, if I didn't have it then and I don't have it now, I didn't have it. Therefore, the wheelchair was completely unnecessary.
That switch is so insane. Like that's the real Gypsy. And then we're going to bring it back to performative Gypsy, showing that she's just, being open and honest and vulnerable. And this is so hard for her, but really it's a pain in the butt for her to have to explain to people why she actually has lied for years.
Now let's move on to dysmorphic facial features. So, I specifically have very distinct eyes. My eyes slightly slant, and that is the effect of the genetic condition. Epilepsy is a seizure disorder that is also very common with this genetic condition. However, I don't remember having any seizures growing up. That's not to say that it didn't happen, but I can say with certainty that I don't have a condition of seizures currently. So therefore, I don't have epilepsy. It is entirely plausible that I had epilepsy in my youth, my very young youth, but then I could have grown out of it. That is something that's entirely possible. Whether these seizures that my mother claimed I had actually happened, I'll never know. Moving on to strabismus. So it's a difficult word for me to say, but it just basically means cross-eyed. So my right eye, I was born...
And instead of showing the actual facial features or unique characteristics that come with this microdeletion, she's going to Wikipedia and saying, what's a dysmorphic facial feature? That doesn't apply directly to her chromosome deletion. I don't know if she's just thinking people wouldn't understand the word and that's why she's doing it, but I think it's a little bit misleading and dishonest of her to do that, and I think that's why she purposely did that. So for Gypsy's specific chromosome deletion, she has unusual facial features. Most children and adults with 1q21.1 microdeletion look like other members of their family. They may, however, have one or two slightly unusual facial features, such as unusually prominent forehead, deep-set eyes, somewhat bulbous nose. These features do not usually make them stand out, but they may mean that your child has passing resemblance to others with the microdeletion. Unique families have commented that their broad forehead can make their child's face look more triangular. Where more than one child in a family has the microdeletion, the unusual facial features are not necessarily the same. A gallery of adults and children with the microdeletion have been published and is available to families on request. If you are someone that has this, you can request those pictures of other people, and you will see that there are people that look very, very similar to what Gypsy does. Obviously, we all know that the girl on the front of the information packet that they give people that are diagnosed with this looks like Gypsy Rose. And that is not I'm not saying that to be anything bad. I'm just saying that it's just a statement of fact.
Epilepsy is a seizure disorder that is also very common with this genetic condition. However, I don't remember having any seizures growing up. That's not to say that it didn't happen, but I can say with certainty that I don't have a condition of seizures currently. So therefore, I don't have epilepsy. It is entirely plausible that I had epilepsy in my youth, my very young youth, but then I could have grown out of it. That is something that's entirely possible. Whether these seizures that my mother claimed I had actually happened, I'll never know. Moving on to strabismus. So it's a difficult word for me to say, but it just basically means cross-eyed. So my right eye, I was born with a lazy eye. They also call it a lazy eye. I've seen a lot of TikToks making fun of me for my eye, and I've grown increasingly self-conscious about it. So often I will put my bangs in front of my eye, just to kind of eliminate a lot of the teasing that I get for it. So this is something that I do have. I also want to put out there that it's not okay to make fun of people, guys. It's not funny. You wouldn't want it being done to you, so why?
So she's a lot of the times when people have seizures, they are not actively hooked up to a monitoring system. That is how it happens pretty much in the real world with people that have seizure disorders. But the way that she's saying this is more so I maybe had it when I was really, 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 really young, but that doesn't justify anything that I had in my older years. But having seizures is a part of this microdeletion that she does have. But her mom somehow managed to just, of course, concoct a microdeletion diagnosis before it ever existed and use it as this blueprint for something that never existed. Do you see what I'm saying? Do you see the manipulation in the word choices that she's using? It's to make you doubt her mother more and believe her more, when in fact she's actually misleading you and misrepresenting the facts that are in her medical records. Notice when she's talking about this strabismus, she is saying it's just a lazy eye. A lot of people have lazy eye. That's no big deal, which it isn't. And I don't agree with people making fun of her or doing things like that. I don't Personally, I don't do that. It's not kind because there are a lot of other people out there that have similar features, and it's not fair to poke fun at certain things that people can't really control. But what Gypsy can control is lying. So she has had 4 surgeries on her eye, and if you read what she posted, strabismus, it is poor eye muscle control. So again, relating back to the muscle issues that she has from this chromosome microdeletion, it is an effect, and it is a more rare effect of people with this microdeletion, meaning she is in the smallest percentage of people that display certain symptoms. If you go watch my video that I made on, it's like the statistics of a liar, I think I called it, and I go through literally the percentages and the facts and the statistics about these displaying features that Gypsy has and the symptoms or whatever that she was going through, and she's in the lowest group of people that have this disorder. Not everybody has these specific symptoms, but Gypsy carried every single one of them.
So this is a big one. So the feeding tube. So most people have a feeding tube put in if they are not getting enough nutrition and they are very, very, very sick. Also, if they have any of these other conditions or health concerns that could have led to them requiring one. So let's take a look at that. So I never had a stroke, never had dementia, never had a brain injury, never had head and neck cancer. And this goes back to the muscular dystrophy that we have already established that I never had and currently don't have, therefore making the feeding tube completely unnecessary, and this would fall in the lines of malpractice. So this is another big topic on the microdeletion. So people with microdeletion have a greater risk of developing developmental delays. As far as I know, I am not delayed in any way. I was not placed in public school and didn't have the traditional schooling that most kids grow up having. My mom did educate me via homeschool from ages, I would say like 4 to about 9 years old. And so that left me at like a 2nd grade education. And then the rest of my education going forward, I received within the Chillicothe Correctional Center, where I got my GED. Hypersalivation is when an individual produces too much saliva, therefore making it difficult to swallow as much saliva as they produce. This is something my mother claimed I had, which ultimately led to the removal of 2 of my salivary glands within my throat. As you can see, I still bear the scars on each side of my neck from the removal. These glands specifically are called submandibular, and that is located within this region. How my mother got the doctors to operate and remove this gland is by putting Orajel on my mouth and therefore producing more saliva while I was at the doctor's appointment. And with those claims alone, they removed them, therefore making this malpractice. So unfortunately, with this particular operation that I had, it left me with a few lifelong problems. So problem 1 is I don't produce enough saliva like the average person would. So I don't produce the average, therefore making my throat extremely dry. So you will often hear me clear my throat like this. Also, my lips get very dry, so often I will lick my lips. Many people have made fun of me for it, and again, that's going back to it's not right to make fun of people for their health conditions, and I don't condone it, and it's just flat out not right. So, you see, I just did it. So, it's just how it is, it's unfortunate, and it's just something that I have to live with.
Another lie. Gypsy fails to mention that she's well aware that she had severe acid reflux, so gastric esophageal reflux disease, or GERD, where your stomach is literally boiling and the acid is going up to your throat. She had an issue with throwing up. She's admitted that in the past, that she's had surgeries to make her stop throwing up because there was issues related to her chromosome microdeletion that affected her digestive tract. That is well established within the medical records. And she had to have different variations of procedures because it continued to cause problems because she had so many digestive issues. Again, well documented in her medical records, and she's more than well aware of this. They did swallow studies on her. They did a ton of different things to help her. And she's misleading the public by saying that this was malpractice, knowing that that is a lie. She 110% is fully aware that this is a lie, and there is no medical malpractice within her entire case at all. There is not one single event that doctors can't be justified in doing what they did. And so she's misleading the public, especially those that aren't familiar with the medical industry or whatever. They're not familiar with these procedures. They do not just take somebody's glands out because, well, they looked at it and just agreed and we're just gonna, they're not gonna do that. First of all, no, they're not. I don't care what she says, literally no. And having Medicare, you have to get prior authorizations, you have to do all of these steps and all these other alternatives before you can go have something like a surgery. As you can see here in the medical records that I'm attaching, it says for Gypsy Rose, under GI, she had a fundo/G-tube 4 failure to thrive. That would be Gypsy failing to thrive as a young child for not getting adequate nutrition, probably due to vomiting. Acid reflux, that is very painful and can make you very nauseated and very sick. Difficulty swallowing was another one. Gypsy receives approximately 80% of nutrition through the G-tube. 4 cans of Pediasure at night, can eat soft foods by mouth. Mom states she has made mashed potatoes in every color possible for a variety. Meaning Gypsy refused to eat anything but mashed potatoes, and so her mom, in an attempt to get her to eat more, made mashed potatoes in every color of the friggin' rainbow to encourage Gypsy to eat. But then Gypsy will say, oh, well, I wasn't allowed to speak to my doctors. I wasn't allowed to say anything. It was my mom who did all the talking. Oh, well, you know, it says right here in the physical exam, she's alert, very pleasant and cooperative. Vocabulary seems more advanced than that of 2nd grade. Fluent and engaging, extremely polite. So how would they know that your vocabulary is more advanced and you're fluent and engaging if you were not allowed to speak to your own medical doctors? And another instance in the medical records, it says Gypsy says she thinks she's allergic to cow's milk, and the mother seems to agree. Gypsy was the one speaking. Gypsy was the one communicating. Not always Dee Dee. Yeah, Dee Dee was doing some explanation and talking, but Gypsy was as well. And Gypsy's fully aware that she had these GI issues. That's why in her medication list, it lists Zantac twice a day. That's an antacid. It helps with acid reflux. She's also got lactulose, which is for constipation. She had issues in her digestive system. It is even said by Rod, he admitted that she had a lot of issues with her digestive tract, and that is why she had to get the feeding tube. Therefore, no medical malpractice was applied or could ever be applied to this situation. The doctors acted the way that they needed to help Gypsy. Gypsy fails to mention that the hypersalivation thing, her glands were removed following multiple failed interventions that included injecting Botox directly into the glands, and this was done multiple times in an effort to assist with the hypersalivation. She claims the Orajel story was what made her salivate too much. However, everybody knows that if you've ever been around Orajel, it will make you drool, and they can tell whenever your mouth is numb when they're looking at certain things. Gypsy had swallow studies done, multiple things that were done in order to try to figure out what was causing this pooling of drool, because it would affect her at night, which was also verified during a sleep study. So she's again misleading the public by saying my mom put Orajel in my mouth and caused me to drool an excessive amount. That's not really even like a side effect of it. You can be numb and drool a little bit, but hypersalivation to the point where it was affecting her at night and waking her up, which was verified by the sleep study and swallow studies, and the multiple failed interventions with the Botox treatments prior to the glands being removed. Again, leaving out key context and information in order to paint her mother in a bad light and paint the doctors in a bad light, saying it was medical malpractice when it was not. It was absolutely not. And why would Dee Dee stop at just 2? Why wouldn't she opt for all 4 of those glands to be removed? Why would only 2 sets need to be removed? For somebody with Munchausen syndrome by proxy, nothing's ever good enough, right? They would continue to push more and more. She would have went back to the doctor and said, oh no, she's still drooling too much. I think we better get the other ones out too. You know, instead of just being like, nope, we'll call it good. And these Botox treatments lasted for very long periods. So it wasn't like, okay, we're going to try this 1 week and then another week and then we're going to take them out. It was like 6 months to a year intervals of testing this and making sure that it was helping. And when it ultimately wasn't helping enough, especially with her swallowing problems and her sleep patterns, yeah, they're gonna intervene. And again, Gypsy was vocal during her appointments. There is nothing that the doctors did wrong whatsoever. And she misleads the public by making these statements by saying, yeah, that was all it took, and then they removed them. No, it didn't, and she knows that. She has her medical records. She's more than well aware what they say and how that is a lie. She knows it.
So there's no specific reason listed in my medical records as to why I had dental extraction, but thank you to Peppermint Sage in Lake Charles. They did an amazing job on my teeth of restoring my teeth. This is a bottom bridge and this is a partial. Thank you so much. I have so much more confidence now. But again, this was completely unnecessary. This is just, that's just wrong on so many levels. The fact that dentists did this, not this, but this, without any medical evidence to back up why this was necessary, there's nothing to justify this in my medical records at all. So,
except cavities. Cavities, teeth rotting. She had multiple cavities. That's a reason to pull teeth if they're so severely decayed. But yeah, there's no medical reason whatsoever besides rotting teeth. In the medical records, you can see there are multiple cavities in the teeth. You can look at her teeth. You know she had essentially what is referred to as a bottle mouth from she voluntarily sucked on a bottle until she was in her 20s, which she admitted to Nick as some moment of being honest and vulnerable, saying I still suck on a bottle that she drank her Pediasure out of. So she wasn't getting her Pediasure through her tube, she was sucking it through a baby bottle. The flavor, strawberry to be exact. She had so much Pediasure, she had literal pallets worth of Pediasure stacked up in that house. And princess type of bottles and stuff like that. That was a habit that Gypsy had that she obviously didn't want to break on her own. I sincerely don't think Dee Dee wanted her to drink out of a bottle, but, you know, that is a thing. And then sucking on a bottle and going to bed, dentists tell parents, do not do that because it will rot your baby's teeth. Having that milk on their teeth at night is one of the easiest ways to have your baby have rotten teeth as they get older. And you can tell just from images and things like that Gypsy's teeth were not in the greatest of conditions. And since Gypsy still had salivary glands, she didn't have all of them removed, she was still producing saliva, so that wouldn't have been an effect to cause her teeth to rot. It was the excess of sugar and the lack of dental care. It was 1000% justified for the dentist to remove what teeth they needed to and to give fillings and crowns on the other ones. And also, Gypsy claimed that this was from chemotherapy in the past, and recently she said, I never said I had chemotherapy. Others have pointed it out. She said, I never said that, but you can watch in this clip from the first season of Gypsy Rose, Life After Lockup, that she did insinuate that she had cancer and chemotherapy, which even in the dental records, it says that they told the dentist that Gypsy had cancer at age 5 and had been in remission ever since. So even at that point in time, it was never said that Gypsy had cancer. It wasn't ever just assumed to be actively in, having whatever it was, the type of cancer that she said, leukemia. It never said that. It said it once at the dentist's office, and it said from age 5, as you can see. But while she tries to deny that she ever said that she had chemotherapy and makes up this random excuse, as you can see in the comment that she left to, I believe it was Case, who also makes content, if you guys want to check them out. And he posted a video about this with the Lifetime clip.
It's really all I needed. But here, let me show you. Gypsy goes on to say, actually, I never said that. What I said was, people often lose their teeth to chemotherapy. I never said I had chemotherapy, but my mother said that I had chemo, and that's all I saw. Well, in scenarios like this, it's always good to check the tape. So let's see what we have on film.
Your records.
My teeth is something that I've always been really insecure about. The hospital gave me free dentures because chemotherapy and treatments like that will rot your teeth.
But I also want to show you where Gypsy said in a live chat one time in response to somebody that asked if she had chemotherapy, and she literally told them once a week. The lies will always catch up with her, and this is what is so important for people to realize, that everything she's telling you, if she says she didn't say it, you can bet your money she said it. That's just how it is with her. She lies so many times she cannot even keep up with the lies. She forgets how many, and that's the thing. When you're telling the truth, you don't have to remember it. So that was the first part, and then Gypsy posted a part 2 as well.
I don't have. Unfortunately, there is a 50% chance that I may pass this genetic condition to my children. Thankfully, we are monitoring Aurora quite diligently, and so far, the geneticist has said that she does not display any of the characteristics of this condition. What does this mean for the possibility of having more children going forward? I really don't like the idea of the possibility of continuing to play Russian roulette with the possibility that my child may end up having this genetic condition. My child can grow up living a perfectly normal life with the condition, or they can display the characteristics and the conditions that are correlated with the genetic condition. And that's just something that I really don't want to play with. That's something that I don't want to leave up to chance, not if I can help it. So most likely we'll have to do something like IVF, so we can narrow down and actually select the genes of our future children to make sure they don't have this microdeletion. So with that knowledge that it can be passed down from parent to child, where did I develop it? So my father was tested for this deletion and he did not have it. He came back negative. And unfortunately, we can't test my mother. So 2 things could have happened. I could have developed it from my mother and she could have passed it down to me, or it could have been a mutation within myself that it developed. So with that being said, there is a very big possibility that as a child, I could have displayed health conditions that caused my mother to be very concerned, and therefore perpetuating Munchausen by proxy. Munchausen by proxy often will begin with something very small, a small health concern that often the parent will exacerbate and make bigger, often leading to further abuse later on down the line. So going into that, I really want people to be vigilant in recognizing the signs of Munchausen by proxy. I understand that it is very difficult to kind of peg down, especially it's kind of like you don't want to question a parent, especially one that displays such concern, because you think that it's out of love. You think that it's out of protection of that child, of their child. But in my case, it wasn't that way. So that's why I do my best to advocate for Munchausen by proxy awareness. Kind of going back into the microdeletion condition that I have. I've seen a lot of people think that just because I had all these surgeries that they were absolutely necessary because of the deletion. That is not true. That is a false narrative. So education is vital in understanding my story in particular.
In the messages that she sent to her friend Allena on Facebook, it was then determined that she knew she had a chromosome microdeletion, and she even told Rod, because Rod admitted it in one of the documentaries he was in, saying that Dee Dee told him it was some kind of genetic disorder, and neighbors believed that Gypsy had a microdeletion. She was telling people that she had the genetic disorder. So it was well known. They used this also they know that's what explained all of the symptoms. But as Gypsy got better, the doctor trips became further and further apart. That is why Gypsy stopped going to see medical professionals for years prior to the murder of Dee Dee Blanchard. Gypsy was not going consistently, and Dee Dee even said that she was fine with where Gypsy was at and didn't want to research further into the genetic disorder. No parent with Munchausen syndrome by proxy would ever just say, we're all good, let's go home. It doesn't just end. It doesn't just stop randomly on one random day. No, they keep pushing and further and further and further. Gypsy stopped going to the doctor. Had to put in a request for a simple prescription refill because Gypsy had not been seen in so long. I'm talking years. Gypsy was not consistently going to the doctor, and she had not been to a medical professional in years prior to murdering her mother. And she knows that. There was no Munchausen syndrome by proxy, there was only malingering. And she's misleading the public by attempting to act like she's being honest and forthcoming with information that she doesn't have to share, but it's a way to manipulate the public further. She knew it before she decided to trick Ken into getting her pregnant. She was well aware. She never didn't believe it. As much as she wants to pretend, and like she says in her book that she thought it was made up, she knows she had it. She knows she tested positive for it. That's why she told Allena. She knows her mother was also tested for it and didn't have it. She has the records. But what we don't have is the fact that Rod, we don't know if he actually tested for it or not. Maybe they should come out and provide his medical records as well so we can see where this actually came from, because we have the record that says that Dee Dee did not carry this genetic disorder. She knows that, but she has to place the blame on her mother, knowing that she can't be tested because she's gone, but the record's right there. Anything to make her mother look like the cause of all her problems in any way that she can, the same way that she does to Nick. She sits there and tells people that she felt like she took 2 lives that night, and the reason that Nick is sitting in prison for the rest of his life, but yet she'll come on to TikTok and run her mouth about him and call him an autistic little buttercup or whatever it is that she calls him. Disrespectful. I don't know if you guys saw this comment that she made on Justice Junction's TikTok page. P.S. That psychopath is right where he belongs, and he's gonna stay there for the rest of his GD life, and anyone who defends that POS is just flat out ignorant. Because this was in response to people saying, oh look, Gypsy was the one that brought up the whole offering up her daughter when she comes of age to Nicholas, and tries to blame him. She says, keep in mind that I was forced to say that at the demand of a deranged man. I was used and abused by a psychopath, and he was the predator. End of story. He didn't want you to even say that he was like Charles Manson, so why did you call him that? He did not understand what was going on. You literally chewed him out for not acting excited enough about committing the crime. Does she forget this? That she said, I don't know, I was expecting like joy or something, knowing that she was convincing him to commit murder. She was setting him up, manipulating his mind, just like she's manipulating the public right now. She wants to claim to be an advocate, but not for Nick. She shows her true feelings about Nick. Whenever she says she felt her punishment was too harsh and Nick is where he belongs, she means it. And I know for a fact that she will do whatever it takes to make sure that he stays there and he never gets the chance or the opportunity to speak freely about what really happened between the both of them. You can't offer forgiveness to somebody that is not sorry for what they've done, and Gypsy Rose Blanchard is not sorry. She is not honest. She has no integrity. She will never be completely transparent about what really happened, and the fact that her mother did not medically abuse her. There was no malpractice committed by any single doctor that saw her whatsoever. Every single why do you think she only ever brings up the few surgery scars that she has? Because she didn't have hundreds of surgeries. She was not under anesthetic hundreds of times. That's why she will always, always, always bring up the neck and the leg and the feeding tube. Aside from ear tubes for chronic ear infections, which is a side effect of the chromosome microdeletion that Gypsy Rose has, eye muscle surgeries, chromosome microdeletion, every single thing this girl suffered with as a young child, and probably still to this day, because I don't believe her for a second that she doesn't take medication, that she doesn't do anything. The chromosome microdeletion affected her in a huge way, and it's literally documented for everybody to sit and read if they will read it. Please like and share this video as well to support my channel and get the actual truth out there. And see you guys in the comments. I will see you guys later. Bye.